Okay, Dr. Gillespie, so let's go ahead and get into these questions. First off is, what are the main health considerations for newborns and infants during the cold winter months?
Yeah, I think that's a great question. Hopefully, we're going to cover a lot of these things as we're answering questions today. But I feel like the big topics and the big concerns parents usually have are related to how we're dressing baby for cold weather, whether that's indoor or outdoor, safe winter travel. So, for us specifically as pediatricians, making sure parents know about car seat safety and dressing baby for travel in the car during those winter months when it's cold. Also, home care for common winter weather issues. So, cold symptoms, stuffy noses, dry skin, those kinds of things that all of us really struggle with here in the Midwest during the winter months, but for baby as well. And then keeping your little one as healthy as possible during respiratory season and how we can best do that.
Yeah, definitely. So let's say, we're inside a lot of the winter, luckily, and many of us have nice warm homes, but how can we dress our babies during the day indoors to keep them, comfortable?
Yeah, this is a common question we get, especially because babies are just so little and we want to keep them nice and warm and cozy.
Yeah.
A good rule of thumb is just for babies and young children too, but especially newborns, to dress them in one more layer of clothing than you as an adult would be comfortable wearing in the same conditions. So at home, oftentimes, if we're in long sleeves and pants, we want baby dressed the same way, maybe with a wearable blanket or swaddled while we're holding them. That might be a hat while they're awake, but we don't want to have the hat on while they're sleeping in the crib because it can potentially pull down over their face and get in the way of their breathing.
Hmm.
I think it's important to remember this, not so much for newborns, but as our little ones are more mobile, not forgetting socks or booties in the home because
Yeah.
bare feet sometimes can be pretty cold. So if we're wearing socks, baby definitely should be wearing socks or booties as well. And then one of the ways kind of around extra layers if we're inside and we don't necessarily want to bundle up is the warmer materials like fleece for jammies, other softer things that we can wear that keep us warm inside as well. So those are some of the common things that we see for keeping babies warm while they're in the house.
Hmm. And isn't it true that most of our body heat escapes through our hands and feet? I think I read that once and I've always wondered if it's true.
Yes, so that's true. And then heads as well. So, especially newborns, and you'll see in the hospital, a lot of times we have our babies with their hats on, covering their ears to kind of help with that escape of heat. Babies just aren't as good as regulating their body temperature. It's something that we're learning shortly after we're born. So, regulating that through the circulatory system. So, we do a little bit of extra help making sure that babies are staying warm in those areas because they're more likely to be colder in their hands and feet and lose heat through their head than we are.
Okay, gotcha. And I do see we have about 25 people watching right now, which is great. So I just want to remind you all watching to leave a comment below to be entered to win our Boppy Pillow giveaway here at the end of this presentation. Okay, so what about when our baby is out and about? How do we handle layering for trips in the cars, going to the store, the doctor's office, etc.?
Yep, absolutely. So that same rule of thumb applies. So if it's too cold for you, it's too cold for a baby, generally one more layer than what you're wearing. But the hard thing I think in the car is making sure that we're doing that safely so that our car seats are still safe and effective. So when riding in the car, a lot of times it is about thin layering. So snug layers rather than thick, bulky coats, snowsuits, those types of things. So tights, leggings, long sleeve bodysuits can be helpful. You can always add, fleece lined pants or leggings or a warmer top, thermals, thin fleece jackets, those are okay. And then in the car, kind of like talked about with hands and feet, you don't want to forget hats or mittens, socks or booties while we're in the car because they can help keep kids warm without really interfering with those safety mechanisms of the car seat. And so the reason we talk about that, it seems a little bit counterintuitive because you want baby to be nice and warm while you're in the car, especially
Yeah.
in the winters here in the Midwest. Our cars take a little bit of time to warm up. And that is something to keep in mind. With a baby, you're just going to be adding extra time to getting ready for travel in the morning, which we were already going to do with the baby. But now for the winter months, we're going to spend even more time making sure the car is nice and cozy for them if we can. So the car seat safety reminders are nothing bulky that ever goes between the child's body and the car seat. So whether that's between their back and the car seat or between their body and those harness straps. And the reason for that is, with impact or anything in the car, the compressive forces really shrink those things down and then make that harness looser than would be considered safe for the baby to be in there. The other thing you want to remember is making sure baby's face should be uncovered. So blankets, those kinds of things shouldn't be over the car seat while we're in the car specifically. There are some that have like an opening that keeps baby's face exposed, which is what you want. And I think the other important thing to remember is there are a lot of products on the market that are
Yeah.
marketed for baby in the car seat, but that doesn't necessarily mean that they're safe to use in the car seat. So some of the options that we have that would be keeping with those safety recommendations, but also keeping baby warm, would be a blanket over the top of the harness straps or over the top of the car seat. You can also put this, I realize this sounds a little silly, but it works well for some families. My husband doesn't like this option. Putting the coat on backwards, so then it's
Okay.
over and over it can be a little bit work, but it keeps baby nice and warm.
Yeah.
Um, but it's a nice option for the coat that you're already going to bring with them, and that way you can still use it, but in a safe manner in the car seat. There are also some kind of poncho style, like jackets, or anything that go over the front, so you can flip forward over the harness without it being between the straps or behind the baby. And you can use car seat covers, but it's only if there's no layer underneath the baby and we're able to keep their face exposed. So there are products like that on the market. So as long as they meet those parameters, it's okay. You just want to be extra careful with what you're picking.
Mm-hmm. Awesome. So much good information you just mentioned. And we're getting so many great comments thanking you for joining us and asking additional questions. So thanks, everyone. We will answer all live questions here at the end because you might get your question answer sooner than you think. Okay, so let's talk a little bit about sleeping. About how many layers at night should baby wear for sleeping? And what would you recommend they first wear when they first get home from the hospital?
Yes. So I feel like this is something a lot of parents are concerned about. They just want to make sure that the house is warm enough and comfortable enough for the baby. And this kind of goes to the car as well. So as much as we want to keep baby warm and cozy, we also run the risk of overheating because babies just aren't as good with temperature regulation in general.
Right.
Um, so we just want to make sure that we're finding that fine balance between kind of Goldilocks, not too hot, not too cold, so that baby is perfectly comfortable. I think the most important thing with keeping baby safe for sleep is just making sure we're following those safe sleep recommendations. So baby on a flat surface without extra fluffy things that they could potentially cover over their face that would give them trouble with their breathing. So things like blankets, big blankets, fluffy blankets, quilts, pillows, really bumpers on the cribs, anything that's loose should be kept out of that sleeping environment because they are associated with a higher risk of SIDS associated deaths, especially before baby is able to roll over and control that themselves.
Mm-hmm.
So for a newborn, it's really best to use those one piece sleepers. Some families prefer kind of the footy pajamas. The gowns are really helpful. So kind of a long sleeve gown that covers the feet but is easy access for diaper changes at night is really nice, with the addition of either a transitional swaddle or other safe swaddling option over that. So sometimes that's a sleep sack with or without a swaddle over it. So you can have one that's just like a blanket that their arms come through. Some of those even have a swaddle that velcros over the top of it, and those are considered safe for sleep. You can also have just a traditional swaddle with swaddling the baby tightly with those jammies on underneath. So they're typically pretty thin, usually made of cotton. But in terms of both the jammies and then those wearable blankets, whether they're swaddled or unswaddled, you can have warmer materials for winter too. So some of them come in a quilted variety. There are fleece varieties for those colder nights in Nebraska, if that's something that you're worried about in terms of the temperature within the room. But like we said earlier, you want to avoid hats, anything that can pull over the face, and then those loose bedding, blanket, big stuffed animals, anything like that in the crib.
Perfect. So, how cold is too cold to be outside? Can we get them bundled up so we can go out for a walk?
Yes, I think it's really important to, if those are things we're going to be doing as a family, include baby as it makes sense. And so it's a little bit difficult. There's not hard and fast parameters for it's at this number, it's too cold for a baby to go outside. But the things to keep in mind are just that babies, children, but babies in particular, are more risk for cold than adults. So their bodies are smaller, they lose heat more quickly, kind of like we talked about. They're also at an increased risk of hypothermia or low body temperature because their nervous system is still developing. They have a smaller amount of subcutaneous fat to keep them warm. And they aren't able to shiver to bring up their body temperature like we are. So those are all things that make them more at risk to the cold. So again, general rule, and then we kind of talked about this with dressing inside too, but if it's too cold for you, it's too cold for baby. So if you're
Yeah.
not comfortable, baby is certainly not comfortable. Important to check the wind chill before you're going to be outside. There's a little bit of variation in what's recommended, but typically it's okay to be outside as long as the wind chill factor is greater than 20 degrees for short periods of time. The hard and fast rule is temperatures or wind chills below -15. You should not be outside at all. And that goes for all of us. I don't know about you guys, but I'm not out in the wind chill of -15 here in Nebraska. But that
No.
would be a strong recommendation not to do that with your infant.
Yes.
Um, in terms of going outside, it's similar to what we've talked about before. So thin layers are the best way because then you can take them off. You can add some more without it being bulky and potentially overheating your baby. So several thin layers and staying warm and dry is also important. So this is less important for newborns, but as your child gets older, if we're playing in the snow or we're outside when we get wet, that really increases that risk of hypothermia and having problems with cold. So if we do get wet, if we have spit up, a blowout, whatever you have in our outfit, we have an extra outfit so that we can change so we're not wet with the cold. Those two together do not mix well.
Right.
And then important to take breaks too. So a reasonable limit for time spent outside. So newborns and infants can participate with family for outdoors. So if we're going for a walk, maybe we're going for a trip to the zoo, as long as we're appropriately dressed and kept warm, but needing to monitor frequently. So every 15 to 30 minutes, checking in to make sure that baby seems comfortable, does not feel cold to the touch, anything like that. Usually 30 minutes is a good rule of thumb of if we're going to be outside for a walk, we're coming either home for a little break before going back out, and definitely checking in to make sure baby still feels comfortable.
Okay. So then what are those signs to look for if we think that our baby is too cold? What are those signs?
Yeah, so babies in general usually have cooler distal extremities, so fingers, toes, hands, like we talked about, we lose heat through those. And as the circulatory system becomes more mature, we have less of a problem with that, though we know that for our bodies as well. Those are more prone to cold areas. So if those areas are a little bit cool, some of that is fairly normal. If they're very cold, you want to be checking to make sure baby is not cold other places. So stomach, the back, the face, those areas should not be cold. So if they're cold to the touch, that's something that's a little bit concerning. Also, any bluish or purplish discoloration of the lips, the mucous membranes, those hands or the feet, those indicate that baby is too cold as well. In terms of symptoms, they're pretty non-specific for babies, but what we typically see is baby might be more irritable or fussy, not feeding well, so not eating well, whether that's bottles or breastfeeding. It's usually the first sign that something is going on with baby where they don't feel like their normal self. So the first thing you'll see is not feeding as well. You might also see decreased activity or increased sleepiness. So those are the main signs that you want to look out for in terms of if you think baby is too cold. And if you do, you're checking your baby's temperature. And the AAP recommends that you're taking a rectal temperature for all children under the age of 3, definitely for your newborns, definitely in those first couple months of life, because that is the most accurate body temperature reading.
Great. So what other ways can we make our home more comfortable for new baby? So, people ask about using a humidifier. Do we give them warm baths daily, etc.?
Yeah. So this was kind of eye-opening for my family when we welcomed home our first baby. So just checking the thermometer, because in general, our home should be somewhere between, it usually says anywhere between 65 and 75. 65 to 72 is a little bit tighter for a home and a sleep environment for a baby. And this might be quite a bit different than what we're comfortable at sleeping at. Kind of depend. If it was up to me, the house would be, 80 degrees all the time.
Yes.
And if it was up to my husband, it would be 50 degrees.
Right.
But for a baby, she kind of runs the show. So
Yeah.
just making sure that we look at our thermometers. And then if we do have any of those preset things, that we're adjusting that for being home more often now with a newborn. So it's always kind of in that 65 to 72 degree range. Humidity in the house, especially in the Midwest in the winter, it's very common for the heaters in our homes to dry out the air in our homes. And that makes it a bigger risk for things like congestion, just dry skin, those types of things. So some people have humidity systems throughout their house, which is excellent. You can also get one just for baby's room. At this time of the year, you're really not wrong to run it 24/7, just to keep it nice and moist in there to help baby with comfortable breathing and then less drying out of their skin as well during the winter months. It's also okay to skip the bath. So a warm bath is really nice. It can be very soothing, but newborns really only need to bathe 1 to 2 times a week. And you'll find out very soon that most babies do not like being in the warm water and then taken out of the warm water. It's actually more uncomfortable for them and they don't enjoy that. So with skipping frequent bathing, obviously if there's a mess, a blowout, anything like that, bathing is easier to do. But if otherwise baby isn't dirty, visibly dirty, you have a less risk of a dry skin and discomfort with skipping those baths that we don't need.
Okay. So then with that dry skin, is it safe to use lotion on our newborns when they have dry skin?
It is. So commonly what you'll see right after babies are born is that they do have dry peeling skin, and that is very normal. It kind of depends on when baby is born. So as baby gets used to their new environment, you'll likely see that it gets maybe a little bit worse before it gets better, especially if your baby is born before 40 weeks. So those babies born between 40 and 42 weeks often are already kind of like a cracked peeling skin appearance. And that's very normal. It's their bodies getting used to being out of a totally wet environment to this dry environment and accommodating that, and then having their newborn skin kind of change in those first couple
Mhm.
of weeks. It is okay to use sensitive skin, scent-free lotions for dry skin if you prefer, but especially during that newborn period, those first couple of weeks, it might not make much of a difference.
Okay.
Dry skin will kind of run its course in those first few weeks typically, but it's not dangerous to use something like that as long as it's sensitive and scent-free. We kind of talked about this with baths as well, but in terms of dry skin, if it's something you're trying to combat after bath care, it's one of the most important ways to kind of help a baby out with dry skin. So you want to make sure that you're using warm but not overly hot water for bathing, because overly hot water will dry out skin more. For babies, especially newborns, it's okay to skip the soap if you don't think they need the soap and you're just kind of washing them with the washcloth. If you are using a soap, make sure you want to use a gentle newborn soap without scents or chemicals, very benign soap. You want to make sure you're patting dry and paying special attention to the rolls in the neck, under the armpits, and in the diaper area. It is very common that we see kind of like a mild skin breakdown, and it's because babies are so, kind of stuck in this flexed position. They're nice and cuddly and cozy. With breastfeeding or with formula, they may get some of that milk in the neck rolls, and if we're not drying them, same with the armpits and in the diaper area after bath, that moisture can stay in those creases and then lead to skin breakdown. So you just want to make sure you're really looking at those areas. It's a common thing we see. It is normal. But if we know what to look out for, it can be more preventable.
Mhm.
And then if dry skin is really an issue, you can lock in moisture with barrier cream. We really recommend Aquaphor or Vaseline, something that's really thick, emollient, before putting on jammies. So in the winter time, it actually is a nice time to kind of do that and then zip up the footy pajamas and kind of get them all cozy in there, to really help lock in that moisture for dry skin.
Yeah, that's great. So we do have just a couple more questions on our list before moving into some of the questions in the comment section. So I just wanted to remind you all, if you have a question for Dr. Gillespie, now would be the time to comment, and also comment to enter to win today's giveaway. Okay, so what would you recommend, Dr. Gillespie, during the winter months with COVID and colds and flu season to keep baby healthy?
Yeah, I feel like this is one of the most stressful things for parents in general, and especially new parents, of just what do we do? How do we do this? How do we keep our newborn safe? So during that first 30 days of life, so during that newborn period, I think it's important to know that we take fevers very, very seriously. So I would highly recommend reducing any unnecessary exposures or sick contacts, just to reduce the infant of the risk of your infant getting sick. So that newborn immune system is still developing after birth. So your infant's not as good at fighting off infections, specifically ones with systemic symptoms or infections at a higher risk for meningitis. Babies also have a different anatomy and physiology with breathing. And so how they handle respiratory illnesses is different in comparison to bigger infants and then also adults. So they have smaller airways, they only breathe through their nose, they're at an increased risk for ear infections because of their anatomy. So it's important things to remember when we think, okay, mild things, but we really don't want our infants getting sick because they don't tolerate being sick as well as we do. So babies also don't necessarily show all the symptoms that we do when we're sick. So we kind of talked about those earlier with cold, but they're very similar. Poor feeding, increased sleepiness, irritability, those are all things that we're on the lookout for. And then any fever, which is considered 100.4 or greater, is a medical emergency where your infant needs to be seen immediately. So just keeping all of those things in mind of what are we looking out for? What are we concerned about? That's what we're looking for, especially in those first 30 days of life. And so tips for kind of avoiding all of those things, which is really hard during respiratory season, especially this respiratory season, we're just seeing a lot of viral illnesses in general. But most of what we've been doing during the current pandemic pertains to those health and safety measures during respiratory season for little ones. So hand washing and sanitizing before any contact with the baby. minimizing the spread of germs through contact with secretions, whether that's covering coughs if we are symptomatic with a cough, avoiding kisses for anyone with symptoms, which can be really hard with grandparents and little brothers and sisters. But it's something we want to think about in terms of keeping baby healthy.
Yeah.
Masking around the infant for non-household contacts. It's not required, but it's something to keep in mind if you're having people in and out of your house who want to meet your brand new baby. Also avoiding large group gatherings, busy high traffic places like stores or malls or restaurants where there are a lot of different people in one space. And then also our scheduled vaccines that start around 2 months of age, because they really do risk the common bacterial illnesses that we can see as complications in kids. So pneumococcal vaccine, which covers for pneumonia and ear infections, our Hib vaccine, which covers Haemophilus influenza, pertussis, and then influenza vaccine when they're older than 6 months of age. Not specifically a bacterial illness, but we do know there's an increased risk of ear infections and pneumonia after you have an influenza. So all things to keep in mind. And then remembering, just as parents, you get the final say in what the terms of the health and safety measures you feel comfortable for your newborn, especially in your home. So that's kind of a conversation between caretakers and parents of, what do we feel comfortable, what do we not feel comfortable with, and being okay with saying no if there's something you don't feel comfortable with to keep your newborn safe.
Yeah, definitely. And we know, especially with immunizations, it can be a lot to keep track of. So Boys Town Pediatrics does have a immunization schedule tool. So I'll make sure to link that in the comments for all of the parents watching to save, because that's been something that's been super helpful.
Perfect.
Okay, so let's get in. We have quite a few questions that were commented, so thank you everyone for commenting. Dr. Gillespie, would you quickly just recap sleep sacks and swaddles at night, as well as some nighttime temperature recommendations? We had a couple questions on sleep sacks, as in, to what age should they be wearing them? What temperature should we have in the baby's room? Related to that.
Yes. So it's hard because that 65 to 72 is kind of the sweet spot. There's not really like it must be a certain degree. If you're not comfortable, your baby's probably not comfortable well. But if your home's anything like my home, our rooms also aren't the same. Ours is much draftier than hers, and sometimes hers even gets a little bit warmer.
Yeah.
So that's kind of where we want to set our thermometers, and then keep in mind that we might need to make little adjustments in terms of the different sleep sacks that are available. So there are a whole bunch of them, and there's not a one size fits all. In terms of the actual swaddling, you're okay. So swaddling would be anything where baby's arms are kind of close to their body, and then we've wrapped them up.
Right.
So there's different brands that have that as part of their sleep sack, where you have the actual swaddle that you Velcro across. Halo is one of them. They make a lot of different kinds. But there are other swaddles that are just a zip up swaddle that also keep hands kind of away from face. And you might need to experiment with a couple to see what your baby likes, because they are not one size fits all for the baby. You can continue to use those if it seems to help your infant. The reason we use those is because of something called a startle reflex, something that typically disappears around like 3 to 4 months of age, but a baby will be sleeping very comfortably and then wake themselves up. And so we do that to kind of help suppress that mechanism, because it helps them sleep more comfortably for longer stretches without waking themselves up. But if your infant doesn't have an issue with that or seems very comfortable with their arms out, that is perfectly okay too. So in terms of those different options, we have ones that swaddle, we have ones that keep our arms here or down and we just zip them up. We also have the option of just wearable blankets. So they just have holes for the arms to go through, and then it's a full blanket that just zips up around you. So it's not loose, it's staying in one spot. As far as transitioning from the swaddles, you typically want to do that when your infant starts rolling over. So that's usually about 3 to 4 months. It kind of depends on the infant. But the reason we want to stop swaddling at that point in time is if baby for some reason rolls themselves over and their arms are flat, they can't roll themselves back.
Yeah.
So we're kind of minimizing their movements there. So that's the main reason we want to stop swaddling once they're rolling.
Yeah. Great. Okay, and then we have another user who asked, what type or brand of booty works best to stay on baby's feet?
Oh my gosh, none. There are a couple of there's, again, no one size fits all. And sometimes socks are easier for infants to keep on. They're a little bit, especially when their feet are so little. Socks almost work better.
Okay.
The booties they do have nice fleece varieties. The one that I really like is called Zutanos. They're they have fleece and cotton options. You can put their foot in, and then they have a button that buttons on. They stay on fairly well. Again, not one size fits all, kind of
Right.
depends on your baby and their tolerance of leaving things on their feet, which is sometimes why the footy pajamas are a really nice alternative if you're
Yeah.
struggling with keeping socks and booties and or booties on your child,
Hmm.
because they cannot kick the footy pajamas off.
Yeah, that's great. Okay, so this next question says, my baby gets really sweaty in extra layers, especially when we hold him. He seems more
Mhm.
comfortable in a short sleeve onesie and being held or in his swing with a mink blanket. Is this still okay? I don't want him to overheat.
Yes. So that's a really good point. We often worry about baby being too cold. We don't want baby to be cold, and then sometimes we overdo it. And sometimes it doesn't even really feel like we're overdoing it.
Right.
Um, Sometimes babies just feel like little furnaces. You're like, oh my gosh, they're so warm. So I'm really glad we pointed out that sometimes in terms of temperature regulation, the best thing we can do is skin to skin contact with baby. So if we're worried about baby being cold, we do skin to skin with them, and it really helps them regulate their body temperatures as well.
Yeah.
Um, in terms of, I think the hard piece is the overnight piece. So we want to make sure they stay warm and cozy overnight. If they're typically too hot or too cold, they will usually let us know with being fussy and crying and waking up and telling us, hey, I'm not comfortable. A short sleeve is fine, especially if you're comfortable in your house and that's what you're wearing too. It's very likely that baby might be comfortable wearing the same thing. Um, in terms of the blankets that we would use, again, the mink blanket while you're watching, especially for in a swing, comfortable is fine. It's the loose bedding at night when we're not watching that we want to avoid.
Hmm.
So there are different things we'll do during naps during the day while we have eyes on that are okay if baby is comfortable. But commonly we do, I kind of feel like you kind of work to find that sweet spot of how your infant's going to like to sleep. In theory, we say we're sleeping on our back, there's nothing in there. Um, that's what we would recommend and that's what's safest, but not all babies really enjoy that sleeping pattern, and sometimes it takes us a little bit of trial and error to figure out what tools they need to help them be comfortable at night.
Yeah, definitely. And that is a main point throughout this whole week. It's trial and error. And that's what
Mhm.
parenting is, you know. So I know what we'll give so many instructions on, do this, don't do this, don't. But just as Dr. Gillespie says, it really is individual for you and your child. So the next question is, how can baby get vitamin D naturally besides using supplements?
Um, that is a great question. So, unfortunately, with both breast milk and formula, until a baby is taking about 32 ounces a day, they are not getting enough vitamin D just through that only source of nutrition that they have. So
Okay.
sometimes we'll start complementary feeding depending on an infant's development. So where they are in terms of able to sit up and what motor skills they have as early as 4 months, but we really don't need to start even offering other nutrition until 6 months.
Okay.
Um, for breastfeeding moms, one thing that you can do is take vitamin D yourself as a supplement. Typically, it's 6,000 units a day. Sometimes people will do like 10,000 units every other day.
Hmm.
But that level of a mom supplementing gives baby enough vitamin D through just breast milk. Um, but typically, we recommend supplementing up until you're taking about 30 to 32 ounces of either
Hmm.
formula or breast milk a day, which is for a while. Babies don't take that much for quite a bit of time. It kind of depends on your newborn, but anytime
Hmm.
between 2 and 4 months is probably when they're doing that. I would say usually closer to 4.
Okay. Yeah, and for everyone watching too, on Wednesday we are doing our Facebook Live on feeding with Dr. Monica Kelly, so we can talk more about that then too.
And I think the hard thing, especially here in the Midwest in the winter, is we know we get good vitamin D from the sunlight.
Right.
We, with our temperatures here, even if we're outside getting sun, it's typically not enough. Even for us adults, if we try and get outside, if you checked most of us, we're probably vitamin D deficient. And
Mm-hmm.
the reason we really focus on that for babies is for brain development and for bone development. So we need that vitamin D and calcium in order to grow appropriately.
Yeah. Let's see here. Everyone's saying thank you, thank you. Oh, here. Okay, we talked about temperature in the rooms at night. Okay, thank you. We would love to hear your thoughts more on bundling baby for cold in the car seat. So, if you want to scroll back on this video, it is saved on our page after it concludes live. we did talk about that. And Gillespie, they did love your tip about the backwards coat. So
Good. I'm going to tell my husband that because he hates when I suggest doing that because he thinks it's silly. It is hard to get your baby adequately bundled. I think the flip side on something we didn't talk about, but we kind of talked about this in terms of at home, is also monitoring for overheating. So there's a difference between when we're in the car, going across town versus when we're in the car for a road trip. Once the car gets to a comfortable temperature, if you're comfortable and you don't have your coat on, we really want to make sure baby is not over bundled and getting sweaty in the car seat as well. So it does take a little bit of monitoring depending how long we're in the car. One thing I also didn't talk about is just having an emergency bag in your car with extra blankets, dry clothing, hats, and gloves. So if there is an emergency or if something happens, you have those extra resources in your car. If possible, one of the easiest things, well, not easiest because it requires you to get up and be ready and do things first thing in the morning. But if you can get your car warmed up before you're getting
ahead of
in,
time
there's less of this kind of mad dash to try and get baby comfortable because the car is so uncomfortable. It's uncomfortable for
for
us too.
everyone. Yeah.
Their car seat is, if you're me, their car seat is cold because I didn't bring it in. For the little ones, if we're bringing their car seat inside, that's also less of a risk for them being cold because it's been inside at a room temperature all night. So that's something
Yeah.
to keep in mind with your real little ones is if you're able to transport your car seat and bring it inside, that really cuts down on that risk of being super cold as well.
Mm-hmm. Yeah, that's great. And then another user asked, what are good OTC cream ointments for dry skin?
Yes. So across the board, I feel like you'll hear us say Aquaphor and Vaseline,
Yeah.
which seems a little odd because they're lubricating, but they're an ointment, so they're a little bit greasier.
Mm-hmm.
Do the little ones? Babies do pretty well with it. As they get older, do little ones love being slathered in it? No, they do not. But like we said, we're putting them in the footy pajamas and we're zipping it up and we're locking in that moisture, and they will thank us for it in the morning. In terms of other creams for like diaper area, those thick creams are great. Any barrier cream that's really thick is what you want for preventative measures. In terms of diaper, if we're having irritation, then you want a zinc oxide based cream. So that's like those thick Desitin, Bordeaux butt paste, those kinds of things. And you just smear it on like frosting. You can never have too much Vaseline or Aquaphor or
Yeah.
Desitin in an area that is irritated.
Yes, definitely. So this next question is, I'm a first-time mom due in 2 months. Congrats. I'm excited for you. She bought a swaddle that has aloe in it. Would that be approved for use?
Ooh, I don't know.
Yeah.
Probably aloe's a pretty benign ingredient in terms of things that we're putting on our skin. So you might see different things marketed for newborns that have different ingredients in them. So aloe, any of the kind of natural oils, those are usually typically pretty safe. The way you would know it's not is if baby gets a rash. And truth be told, newborn rashes are very common. And a lot of times we don't know what baby's skin didn't like or what we put on it. We just know that we take things away and add them back.
Yeah.
Baby's skin is very sensitive, which is why avoiding putting things on it that we don't need is
Mm-hmm.
usually our best bet, because then we don't run the risk of their skin not liking it, because it's just very sensitive and getting used to being out in our world after they're born.
Yeah. And then I think this is our last question on the dry skin side. So, what can we put on a dry scalp of a 2-month-old? Would you do
Yes.
Aquaphor for that?
So typically that is a really good question. And this is what we call seborrheic dermatitis.
Okay.
Almost, or cradle cap is kind of the common name. It's like our scalp in the winter in the Midwest as well, if you have any issues with dry skin or dry scalp. So it's the same thing for babies. They're prone to it. Again, their skin getting used to being in this environment. Usually seborrhea is a result of kind of overproduction of oil mixing with skin cells that then leaves this kind of flaky, almost like yellowish discoloration on the scalp.
Okay.
It's not dangerous. It really doesn't need treatment. It just sometimes like looks flaky and parents are like, ugh, what is this? But it's not a dangerous thing. Typically what's best for that is actually oil. So like baby oil, or even sometimes people use like olive oil, a benign oil that you put in, and then you almost rub in circular motions in the area where you have that kind of fine scale.
Mm-hmm.
So you can do either like a soft bristled toothbrush, you can use a washcloth. They do have some, Frida Baby has a product that's like a silicone, has like little like bristles on it
Oh,
too.
yeah.
pretty easy to use. So any of those things. So you'll let it sit and kind of soften, and then you'll rub it away and then rinse with warm water. And sometimes you can even put oil on after. I usually wouldn't, because then baby's hair looks all greasy and you're like, why did we just do this bath? Which is why it's nice to put it on first, let it sit,
Yeah.
soak, and wash it.
Okay.
And it can be kind of tough to get rid of, but that's typically how you would get rid of it. And like I said, it's not dangerous. Just as a parent, you're like, oh, I wish that wasn't there.
Right. Yeah, definitely. That's great. Okay, so we do have a question about napping. So, Alexis, we are going to have a discussion later this week. It will be Wednesday night at 6 on how to get through the first few sleepless months related to sleep. So, we'll answer that one then. But I'm going to say the last question here for this before I do the giveaway is going to be, besides safe for baby's body, what about washing their clothes, etc.? What would be best for skin? So, detergent.
Yeah, I feel like for the most part, all detergents, I think, are detergents, and then baby detergents as well. There might be things that you read in terms of like natural alternative detergents. For the most part, those are okay to use for babies. The one that is recommended across the board for newborns is Dreft. However, I have read a couple of things in parents not wanting to use that because there are some of the chemicals that we would see in adult detergents as well. So typically you want to look for something usually without like sulfates or parabens. Those are,
Yeah.
I think, especially the sulfites are one of the things that can be most irritating to skin. Um, and even adults see that sometimes in their clothes. I think, I can't remember which brands off the top of my head. I feel like Gain does not have sulfites, so that's why it's maybe a little bit better of an option. Again, nothing with crazy scents for the most part. So those scents can sometimes be very irritating to skin. So you want to go for something that's either sensitive skin or kind of allergy free without a lot of additives and other things in them. The sulfites specifically are something I know that can cause skin irritation. Dreft is what we use at our house. We haven't had any problems with it, but I know there are families who would like to use more holistic ingredients in
Yeah.
terms of detergent. And really, I would reading the label, but then if you have questions, asking your pediatrician or even like taking a picture of it, say, hey, do you see anything in here that looks weird?
Mm-hmm. Yeah, great. Okay, so the moment you've all been waiting for, the giveaway. We have this little wheel with everyone who commented names. So we're going to go ahead and run it here. Okay, and the winner is Andrea W. So, Andrea, congrats. You won the Bobby pillow. And for everyone else who commented, thank you. We are, like I said, doing giveaways the whole rest of the week for our virtual newborn expo. And if you liked hearing from Dr. Gillespie, she is actually going to be presenting live with us again this upcoming Sunday, January 30th. And we're going to be talking about postpartum care for moms, which I know is a highly requested topic. So make sure you tune in then to catch Dr. Gillespie again. And if you left a comment or if you're watching later, not live, and your question didn't get answered, I will go ahead and message you back through the Boys Town Pediatrics page, and I can mediate, some Q&As with you with Dr. Gillespie. So we'll get your question answered. We just only have so much time on these lives, unfortunately. But thank you so much to everyone who tuned in, and we will see you tomorrow as we are going to be discussing crying with Dr. Sarah Orr. So, Dr. Gillespie, thank you so much for your time.
Yeah, absolutely. Thanks for having me.
Yes, of course. Have a great day, everyone, and we will see you live tomorrow. Bye-bye.
Bye.